President Trump this morning signing an executive order that he says will lower the price we all pay for prescription drugs.
Yeah, that's right. Caribe Devine is standing by now with how this will all work. Caribe?
Hi, guys. The order directs the Department of Health and Human Services to find price-cutting goals in 30 days and then start negotiations between the administration and the drug makers. This measure is expected to face some significant legal challenges. A White House official said that the action makes a promise to crack down on other countries' quote unreasonable practices that suppress drug prices. The administration's executive order would apply to a wide range of drugs and prices in the commercial market. It would include Medicare and Medicaid. The Department of Health and Human Services would work to negotiate lower prices. If that does not produce results, HHS would implement the most favorable nation rule. The controversial policy from Trump's first term would work to reduce drug costs by basing payments for certain medications on their prices in other countries. The quote most favored nation was previously finalized late in 2020. However, it was blocked by federal courts and then rescinded by then President Joe Biden.
So basically what we're doing is equalizing. There's a new word that I came up with, which I think is probably the best word. We're going to equalize, where we're all going to pay the same. We're going to pay what Europe's going to pay. We're going to all pay. Now, there may be some countries in dire need, and I would be willing to sacrifice that and help them. But it's called most favored nation. We are going to pay the lowest price there is in the world. We will get whoever is paying the lowest price, that's the price that we're going to get. So remember that. So we're no longer paying 10 times more than another country. Whoever is paying the lowest price, we will look at that price and we will say that's the price we're going to pay.
So Trump's executive order comes as the administration has been considering imposing tariffs on pharmaceutical imports, which could spark shortages of certain drugs. In a post on Truth Social, the president didn't specify whether the order would apply to Medicaid and Medicare or other government programs. The pharmaceutical industry has estimated implementing the plan for Medicaid and what it would cost one industry trillions of dollars over the next decade. Guys, we'll send it back to you.
Will that come back to us, the people who are paying insurance and paying for drugs? And so let's talk about it. Joining us now is Teresa Dickinson. You are the owner of Melrose Pharmacy, an independent pharmacy. We don't see a ton of those anymore. Thank you for being here. So obviously you've seen this, you saw this announcement today. What's your first thought? Can this lower drug prices if it goes into effect?
It absolutely can, and it is very exciting to hear about this. As an independent pharmacy, drug prices have been out of control for far too long, and it's hurt our patients. So I'm glad that something's being done about it and that President Trump is taking a focus on handling it. There is a lot to be done, and it will be very exciting to see what happens.
Now, when you say obviously out of control, we are talking sometimes these costly prescription drugs, they can be 10 times, here as they are in other parts of the country. Why is that? And does that have any direct effect on pharmacies like yours?
Well, I get my prices dictated to me by the pharmacy benefit managers or the PBMs. So they tell me what my pricing is. So I won't get to choose my pricing.
So there's no effect for you guys?
For me, no. Unless President Trump gets into the area of deciding to get into the PBMs, because those are hands down the reason why our healthcare costs are so high. No other country has the PBMs but us. And that's shows in a problem that we have. But if we get these drug prices fixed, then it's going to help our patients.
You bring up this PBM, and I think I was never aware that this position existed. So you've got drug manufacturers who make the drugs, right? And you sell the drugs, correct?
Correct.
So this person is the middleman in between. What is their job? And you keep talking about this PBM, that this may be one of the issues that you're having in the industry.
Yeah, so the PBM is the person on your insurance card when you go to the pharmacy. It's usually Caremark, Express Scripts, or Optum. They dictate the price to the pharmacy. They dictate to the manufacturer what the manufacturer is going to charge. So then they actually get a kickback and a rebate that they make the manufacturer raise the price, sometimes as high as $600 every single prescription every month for one patient.
So is this someone who works for the insurance companies out of the PBMs?
So they're a middleman that sometimes now they're owned by the insurance company. So Caremark owns CVS, owns Aetna, now owns doctors' offices. So they've been allowed to merge and take control of the whole system.
How come this hasn't been talked about so much because we always blame Big Pharma.
Yeah, it's a very complicated issue to understand. So they also have a very powerful lobby that protect them, and then they have congressmen that they pay. So, you know, it's just getting to the right person who's going to listen and care.
In the form of campaign contributions, and President Trump even mentioned that contributions can go a long way towards this. Some of the challenges of owning a pharmacy that's independent.
I'm getting paid below my cost on $17,000 a month on brand name medications. So the PBMs are dictating that price to me, my contract, and that's what I have to accept. So independents are going out of business. There's less than 100 in the state now. So it's a huge problem. An independent Fairmont pharmacy just went out of business 2 weeks ago.
I appreciate you coming in and talking about this, and dealing with this. And hopefully this situation will end up helping your business and all of us
Yes.
at the same time. Thank you for coming in. Appreciate it.
Thank you, Teresa.